flexion restriction. Here I am on the left side. And the reason for that is I'm going to use this contact as the fulcrum about which the neck pivots. So let's say we have a C4, right lateral flexion restriction, and we'd like to resolve it using this digit pillar pull method. So we have the pad, the distal pad of the middle finger contacting the articular pillar. Next from here, we're going to cradle the skull with a broad hand contact underneath so that we have maximal control over the patient's head. They can feel stable and relaxed in this position. We know that to induce right lateral flexion, we need first left rotation, so we've got that. Now we can right laterally flex until we find our tension. And then from here, when the patient's relaxed, we can give our quick pull. So first we'll relieve our tension and then pull in this direction. So that's what we're looking at. 10%, not deep. This is just a practice to allow us to understand what movement should this be. And that's the movement that we're looking at. So right hand gently pushing away in this instance, left hand, my manipulative contact hand, pulling, depicting that same kind of a downward scooping motion. So if you want to imagine painting a smiley face through your patient's neck, that's one silly way to remember what direction you're using. Good. Any questions on this? The digit pillar pull for lateral flexion restriction in the cervical spine.